In this lecture, we are going to discuss three most important components of the breast. First one is the skin. Second one is the parenchyma. That is the most important functional part of the breast, in which you will see the mammary gland. And third most important component will be the stroma. So let's get started. First of all, we will look at the skin. So skin is basically the most important component of the breast, and it is actually present outside the breast. So in the skin, you will see the two most important component. First one is the nipple, and around the nipple, you will see the pigmented area that is actually called the areola. First of all, we will discuss the position of the nipple. That is the most important thing. So basically, nipple is actually present just below the center of the breast. Okay. So if you see, here is the center of the breast. So basically, nipple is actually present just below the center of the breast. That is the one thing. Okay. And second thing, if we discuss the position of the nipple according to the ribs, then it is actually present in the fourth intercostal space. That is the most important thing. Okay. So here is the nipple. Okay. And that nipple is actually present in the fourth intercostal space. Fourth intercostal space. That is the most important thing. If you see, there are different ribs like 1, 2, 3, 4, 5. 1, 2, 3, 4, 5 ribs. Okay. So in between the first and the second rib, you will see first intercostal space, and here is the second intercostal space, third and the fourth. So basically, in between the fourth and the fifth ribs, there is a fourth intercostal space, and that is the position where nipple actually exists. That is the important thing. Okay. If we discuss the position of the nipple according to the sternum, okay, so basically sternum is actually present at the center of the body. Okay. And at that side, you will see the mid-sternal line. Mid-sternal line. So basically, nipple is actually present 10 centimeter away from the mid-sternal line. So here is the position of the nipple, and that nipple is actually present 10 centimeter away from the mid-sternal line. So there are basically the three most important things. First one, it is actually present in the fourth intercostal space. Second thing, it is actually 10 centimeter away from the mid-sternal line, and it is actually present just below the center of the breast. Okay. And around the nipple, you will see the dark pigmented area that is actually called the areola. And there is no hair present in the areola, and there is no fat below the areola. So here are basically the two most important things which you have to remember about the nipple and the areola. There is no hair and there is no fats below the areola. Okay. Nipple is actually pierced by the different lactiferous ducts. Okay. If you see the, here is the lateral view of the breast. So here is the nipple. Okay. And there are a lot of lactiferous ducts. So here are basically the different lactiferous duct. Okay. Lactiferous ducts. So basically, lactiferous ducts pierce the nipple. Okay. And in the lactiferous duct, you will see the longitudinal muscles and the circular muscles that actually stiff the nipple of the breast. That is the important thing which you have to remember about the nipple. Okay. An important thing, the nipple has nerve supply. So it is actually the sensitive part of breast. Okay. That is the important thing which you have to remember about the nipple. Okay. So another important thing, if you see, here is the breast, at the center you will see the nipple. Here is the nipple area, and around the nipple you will see the areola. Okay. So most important gland that is actually present in the areola is the areolar gland, or you can say Montgomery gland. Okay. So here is the different small gland, that is the areolar gland, or you can say Montgomery gland. This is actually the modified sebaceous gland, okay, and it is actually present in the tubercles raised form during the lactation and during the pregnancy. It actually produces the oily secretion that is helpful in the lubrication during the feeding of the baby, and it is the most important gland that actually produce the oily secretion, and that oily secretion produce the fragrance that actually moves the baby towards the nipple even in the dark. That is the important thing about the Montgomery gland. Okay, next component will be the parenchyma, that is actually the mammary gland, the most important gland that actually produce the milk. Okay, so in the mammary gland, the most important component is the lactiferous duct. Okay, after that you will see the presence of the, here is the second component, you will see the lactiferous sinus. So in the sinus you will see the storage of the milk, and after that you will see the different lobes. There are 15 to 20 lobes, there are 15 to 20 lactiferous sinus, there are 15 to 20 lactiferous ducts. Okay, so there are lobes, and inside the lobes you will see the alveoli. Okay, and inside the alveoli you will see the production of the milk that actually pass from the alveoli, and it will pass or store in the lactiferous sinus, and after that it actually passes through the lactiferous duct. Okay, so here are basically the three most important components of the mammary gland, that is actually the parenchyma of the breast, functional part of the breast. Okay, and after that you will see the third component, that will be the stroma. So in this stroma you will see the two most important components that actually provide the support to the breast. First is the ligament. Okay, that is actually the fibrous component. So here are basically the different fibers that actually present inside the breast. So that is actually the suspensory ligament of Cooper's that actually provide the support to the breast. And second component is actually the fat. So fatty component of the stroma. There are a lot of different fats that actually present inside the breast. So basically in this stroma you will see the two most important components. First is the suspensory ligaments of Cooper, and second is the fatty component. So here are basically the two components of the stroma that actually provide the support to the breast. Okay, and you will also see there is a retro mammary space, and after that you will see the pectoral fascia. Okay, that is the important components that actually present behind the breast, and actually around the breast you will see the superficial fascia. So that's why you call breast is actually present inside the superficial fascia. So we have discussed the three most important component is skin, in which you will see the nipples and the areola, and second component is the parenchyma, in which you will see the mammary gland. In the mammary gland you will see the three most important component, lactiferous duct, lactiferous sinus, and the alveoli. And third component is the stroma, in which you will see the two most important component. First is the suspensory ligaments of Cooper's, and second is the fatty component. So this is all about the three component of the breast. If you still have any question, you may ask in the comment section. Thank you so much.